Hi everybody, it's Dr. Osgood here with GrassRoots Functional Medicine. Today I wanted to talk a little bit about mold and biotoxins. This is a problem that I often see in the clinic, and it frequently gets overlooked, and it can be a huge player with chronic disease, and it's something you really want to think strongly about if you're just not getting better. So what is a biotoxin? A biotoxin is a poisonous substance produced by a living organism. So you can see they can be produced by molds, bacteria, dinoflagellates, or blue-green algae. Some common biotoxins that are bacterial would be from Borrelia burgdorferi, which is the trigger of Lyme disease, or Babesia, Bartonella, or Ehrlichia, some of these co-infections that are also transmitted by ticks. You can get biotoxins from mycobacteria, and another common source is from endotoxins, specifically lipopolysaccharides. If you're familiar with leaky gut, LPSs are a big player with leaky gut and inflammation, and they really relate back to dysbiosis or imbalanced gut flora. So that can create the symptoms of biotoxin illness as well. Beta-glucans, and a big topic that I'm going to really focus in on today is going to be mold and mold spores. So where does mold come from? Well, not everybody's house looks like this, thank God. So, mold is a big player in throughout the community, but it can hide in the craziest places. And most of the time when I ask somebody, is there any chance that you have mold in your house? They say absolutely not. And then later on we find, yeah, absolutely there was a problem with mold. So it's something to seriously consider because you don't have to have an old house to have mold. There's plenty of new construction where there was water exposure during the building process, or there's a lot of old homes too that have mold as a big issue where leaks go, left alone and forgotten about, and 2 years later you see that there's a huge mold issue. So mold is definitely something to really think strongly about if you are suffering from chronic illness and not getting the answers you're looking for. What contributes to mold? Well, one of the big problems is our houses are built so tight these days. There's not a lot of good ventilation, so it increases humidity and sets the stage for mold to grow. Oversized or undersized AC units, that's another big issue that affects humidity. And then another big problem, I think, and why we're seeing it so much as of now is because of the toxic burden each individual is dealing with. One of the problems with mold is that your body's just not detoxifying, which plays a lot into genetics. So a lot of people have the genetics where it sets them up for poor detox, but even a bigger factor is epigenetics, how your environment affects how your genes are expressed. So even though you have negative genetics that may set you up for problems, if you live a life that is very clean and you work on your environment, then a lot of times you can express those genes in a positive way and you don't have as much of a problem there. But because we're all under stress, we have bad diets, we have toxic exposures, we have chronic infections, our burden is so high that mold sets us up for, health failure. So we really have to empty that bucket and figure out what's triggering problems with immune dysfunction, what's triggering problems with a detox and making the body work a lot harder than it needs to. Red flags for mold toxicity: if you have a damp basement, water leaks, flooding, flat roofs, condensation in the windows. If you have an illness that developed soon after either you moved into a house or moved into a new job, you moved to a new location, then that is a huge red flag that there's something in that environment that may be setting you off. Musty odors in the home, a lot of people play that off as, oh, it's just mildew. That is not normal. And if you're very sensitive to smells, that's another sign that you're just not detoxifying and your body is being bombarded by something that is not good. Water damage or discoloration on ceiling tiles or on the walls, that's a red flag for mold. And then if your symptoms get a lot worse when it rains, that's another common sign we see in the clinic that maybe mold is something we need to investigate further. Richard Shoemaker is one of the thought leaders on biotoxin illness, and he's come up with 13 cluster symptoms that correlate with biotoxin illness. So the rule of thumb here is if you have 6 to 8 symptoms, then you really need to look into mold or biotoxin illness further. If you've got more than 8 symptoms, 8 or more, then it's highly suggested that biotoxin illness is a big issue for you. So take a minute and look through these symptoms. And if you match 6, you match 8, or even if you have several going on, it's worth looking into this a little bit further to make sure that this isn't contributing to health deterioration. So what do you do if you expect mold or biotoxin illness? So one of the first steps that I recommend is doing a visual contrast sensitivity test, and you can do this online. Surviving Mold is a great place to look. They've got this, I think it's 10 or 15 bucks to complete this test. Well worth the investment. What it's looking at is your ability to differentiate contrast. And contrast is your ability to discern black from white, but also different shades of gray. The problem with mold or biotoxin related illness is these toxins decrease oxygen supply to the nerves by attaching to fat and the nerve itself. And then the oxygen rates go down, circulation is affected, and the nerve itself, the optic nerve specifically, is negatively impacted, which reduces your ability to distinguish contrast. So this is a quick test that you can do. It tells you right away if you pass or fail, and if you do fail, again, that's the means to take the next step and try to figure out what's going on. It's not 100% specific to mold. Again, some of those other biotoxins can influence this, but it is a great tool. It's very inexpensive, and it can also help you track your symptoms as you progress in your treatment. Another thing is to find a practitioner who knows what they're looking at and how to help you, overcome this problem. This is a journey. When we're looking at biotoxin illness, it is not a quick fix. It takes a lot of time. You want to support all aspects of life, from nutrition to the gut to detoxification to stress. This is a big task, and it's going to take some time. So you want to find someone who can really help you through each step of the way. But you can recover from this, and it can make a huge difference. The biggest factor when you're trying to get through this is to first get out of the environment. Wherever you're being exposed that's triggering problems, you need to get out of that environment. And if you don't get out, if you're still being exposed, you're just not going to recover and see the results that you want to see. So again, my name is Dr. Seth Osgood with GrassRoots Functional Medicine. We have locations in San Antonio, Texas, and West Lebanon, New Hampshire. If you are looking for a practitioner to help you on your recovery to optimal wellness, if you really want to look at what's going on to find the root cause of your health concerns, then we would love to partner with you on your journey. Have a great day.